Well, hello everyone, and welcome to Painless Universal Conversation with myself and Welsh. Today I'll be talking to a guest all the way from Montreal, Canada. She is the current president, executive director of the Sickle Cell Disease Association of Canada. She holds a bachelor's degree in business management. What's fascinating about her is that through her experiences of having her own son who was diagnosed with sickle cell at a tender age, she didn't stop there. She didn't stop just caring for her son. She went out to find out what knowledge she needed to acquire, and also utilize that knowledge to become the president of the Sickle Cell Association for Canada. She's many more. She's not just that. She's utilizing her knowledge of knowing there's a gap in Africa and saying, with this gap in Africa, I've learned so much out here in Canada. How can I translate that same knowledge from where I'm from in Niger and push that so they can have and benefit? Same thing I am learning from out here in Montreal, Canada. Meet my dear friend, Biba. Hello, everyone. Welcome again to Painless Universal Conversation with myself and Welsh. I have the gorgeous and beautiful, all the way from Montreal, Canada, which is the country I really love, here with me. Biba, thank you so much again for joining me. I'm absolutely, I'm always honored when I get an opportunity to speak to you in any form, but this is more an exciting time because you are, doing amazing work. People might not know. You are doing something that is really very close to my heart, something fighting the cause of sickle cell. You've done this, and your story inspires me in so many ways. How you've taken on this challenge, especially in a place like Canada, where there was little knowledge, and how you've made change things around. Before we get to all of that, because your story just goes on for, I could keep describing you and it will never end. Can you tell us a little bit about who you are and what you did?
Well, thank you, and thank you for this great introduction. It's thank you for inviting me, and thank you for providing me this platform. So my name is Biba Tinga. I'm originally from Niger, West Africa. A sub-Saharan country at the door of the Sahara Desert, as I like to say. With my husband, we have 4 children. I'm a mom of 4, 2 boys, 2 girls, and my oldest was born with sickle cell disease, SS, which is why we're here today. I lived in a couple of West African countries. I also lived in the US before moving to Canada 16 years ago, where now I live with my family. And so I'm a sickle cell mom.
Yes, no, this is
yeah.
amazing.
Exactly. And I'm so excited and happy to be here because I think it's an opportunity to tell my story. And I believe in story sharing, experience sharing, because for me, I think like in every story, there is a moment to teach. There's a teaching moment, and there's also a moment to learn, right? So if sharing my story, our journey can help somebody have a less painful experience, then it's good. And if sharing my story can be a kind of a survival guide for somebody who is starting the journey just like us, because we've been going through it, my family and I, for over 30 years, then it's good. So that's why I'm here today.
Oh no, absolutely. Such an honor to have you all the way out from Montreal, Canada. Let's go back to the beginning, because I know he was your first son, and when your son was diagnosed with sickle cell, did you know anything about sickle cell before you had your son, or is it something, because like now when people get married, they know that to test the genotype, and for you, what was it all about? How did that happen?
I must say, I knew that I had sickle cell trait. I was told that, how everybody, like they talk about it, I was young, and my mom said that, you have sickle cell trait, but, not sick, that maybe sometimes you can get tired, but I was never hospitalized or sick for any kind of treatment. So for me, it was just no, you have sickle cell trait. So, but it wasn't explained to me, and the consequences of that. And the other thing is that in my case, I wasn't like, I did not plan to have a child. I was young. I was a young mother. So I became pregnant and I had a child at a young age. And then I just found out when he was 7 months old that he has sickle cell disease. So that's how it happened for me. So unfortunately, it was just finding out, the fact that when you have sickle cell trait and you have a child with somebody, so everything happened at the same time for me.
And
so I had really no big knowledge about the disease.
Yeah. Wait, so when you had him, how did you know he had sickle cell? What were like, for anyone watching now, so, example, people in Africa, I've got a lot of followers from Africa, and they are still getting used, even though it's, very prevalent in Africa, you still get a lot of people saying, well, sickle cell. For you, when did you first understand that there was something a little bit different about your son?
I really found out that he had sickle cell when the diagnosis was done, and then I was told. However, this is something that he has been haunting me to this day. Is that before we had the diagnosis, this little baby, he was 7 months old when we found out. So sometimes he will go into this, like he will cry, he will be screaming. That was not even a cry; he will be screaming, for over sometimes an hour, and nothing can calm him down. We will try, carrying on my back, and he will go from my hand, my mom, my sisters, everybody in the house will try and make him comfortable, feed him, and nobody knew what was wrong with him. He looks healthy. He was, he looks, physically, apparently there was nothing showing. I didn't really know. I didn't know. And to this day, I always sometimes sit down and say, why didn't I give him a painkiller? Maybe he was in pain. Maybe he was in pain, I didn't know. So then he developed fever, and we went to the hospital, and then they misdiagnosed him for they thought it was malaria, because we live in a region where there are a lot of malaria. So we went back with a treatment for a week. Didn't work, the fever was still there. And then when we came back the second time, that's when the doctor said, this face, puffy face, yellow eyes, I think I'm suspecting something else. Let's test for sickle cell. So, we went through almost 2 weeks, of him being sick and being home, not hospitalized, us trying to treat malaria before we found out that, it was sickle cell disease. And then the diagnosis just came like that. As a shock.
How old was he at that time?
7 months old. 7 months. Wow. He was under 1 year. So, the time where, you have this beautiful, healthy baby was quite short,
Yeah. And did a lot of difficulties parents find is knowing how to care for a child who might, who has sickle cell, especially, and as an adult, it's okay to talk to people like myself. You could say, drink water, do this. When they told you, you've never had anything with sickle cell, you knew you had the trait. When they told you, okay, this child has sickle cell, did they tell you what you had to do, or did you have to learn along the way?
Well, that's the most difficult part, to go through. When they give you this diagnosis first, what we need to talk about, like in my case, and I don't know if it has changed, is even the way it's presented to you. At that time, 32 years ago, it was like they present like, okay, your child has sickle cell, and it was like also giving you a kind of death sentence for your child, because for them there was the life expectancy, there was no hope that he was going to live past a certain age. So everybody around you just tells you, well, then that's it, go home, take care of him as much as you can, and then as long as you have that child. So for that, there is, I don't know if they even feel the need, to give you more information. If he's sick, take him to the hospital. They will treat him as much as, the best way that they can, and then that's it. So, and at that time there was no internet, there was no Google to go through and find out, about sickle cell. There was no patient group for me to go and connect with other parents or other young adults going through, and at least to have hope that, if I could see somebody like you, I would be like, okay, so my child can be, okay, but I didn't know. And again, don't forget that, in some part of Africa, up to this day, people do not disclose their sickle cell status. So even a parent with a child with sickle cell might not tell you that, my child has the same condition. So I really did not know anybody that had sickle cell disease that was close to me that I can go to. I've heard of one girl in the hood city, but I didn't know her. So, and we knew because she was one of the only one that, the parents were, open about it, talking about it, that, she had sickle cell disease. So I had to learn on my own. I had to find information on my own. So I remember at that time, I was just starting college. I was a young student. So I had friends my age who were also in their first year of med school. I went to those people. I went to them and I asked them, and they went into their notes and gave me what they had, their class. And they started explaining to me with simple words, that I can understand, with all those medical jargon, and tell me, okay, this is what it is. And even them at that time were telling me, with a very sad face, well, Biba, unfortunately, he's not going to live, for a long time. So, and they were telling me, if you are lucky, maybe he will live till age 15 or less. So that's what I had at that time. And that's what I had to work with. And I think one of the things that always, I believe, helped me was the fact that I was young. I was very young, and I love this beautiful baby. So for me, no, I couldn't just take that, So everything I was told to do, I did. Every time he had, like, even the scarlet fever, I was picking him, and we were at the hospital. If you have to spend the afternoon, I'm going to see the doctor. They're going to give me a prescription. I'm going to go right away, get it, give it to him, and then make sure that, he's always comfortable, and then make sure that, he's okay. So I don't know. That's what I did with, the best I could with what I had.
As a mother who had a child with sickle cell, you went on to have other kids. Was it difficult balancing him being sick and balancing the other kids who didn't have sickle cell, but trying to explain to them how to live and still treat him as normal as possible?
There is something very important that I must say, though. As I told you at the beginning that, I had my child, I was very young, and I didn't plan to have a child. So I did not get married with my son's father, my son's dad. So I did marry somebody else because of the situation, of course, obviously. So, and it's very important that, because part of the work that I do now is educate our community for people to know their sickle cell trait, and then, make, when it comes time to have children, then they can make the decision. If they choose, to marry somebody with the trait, and then they have to live with the consequence that they might have. They have, 25% chance of having a child with sickle cell. So I made sure that, when I was getting married, that, my husband now does not have the sickle cell trait. So lucky enough, I have 3 other children who do not have sickle cell disease, but one of them is a carrier too, because I'm a carrier, right? Yeah. So my 2 boys, one has sickle cell disease and the other one has sickle cell trait. So, and again, it's very difficult because, this young, this other, were younger than the oldest, and the oldest was the one who was always sick. So I can tell you that, and my kids grew up with this sense of emergency always, in the family, that, we're planning something, but just so you know, we might not be able to make it. I might not be able to drive you to this birthday party, because if the brother is in the hospital, I just cannot be at 2 places at a time. A priority has to be set, and it was about the brother being sick. And also, I remember here in Montreal at St. Justine Hospital, when my son was treated before he turned 18, my younger kids spend a lot of time in the hospital playroom. Because sometimes I just have to bring them to the doctor's appointment because I had no other place to take them if they are not in school, right? And at that time they were younger. So they grew up, knowing that, their brother has a serious condition, and they become aware of what it was. We have a conversation about it, and also the fact that this disease, is a deadly disease, because we have to prepare them. So they knew, they were aware of that. So now they are much older. My youngest is now 19 years old. So they are young adults. And I think they are the brother's keeper. It's so beautiful that sometimes I'm sitting here and my oldest son does not live with us anymore. He lives on his own. Then I will see the brother just pick up the keys and go, and he doesn't even tell me. Then he will go pick up the brother and bring him home, because he just texted him that, something is wrong and I need to come home or something, So it makes me happy, but at the same time, we made sure as parents that it's not their responsibility, Yes. It's us parents who have to do our best. So he's independent, but at the same time, it's so important for me that they know that their brother might need them, They have to be the support system that, we created around him. It's I can tell you about something, when the COVID-19 pandemic hit, So my son is an essential worker. He works in a pharmacy, and he had to continue to work, so taking care of, himself and making sure that, he wore a mask and washed his hands. So then we had a family discussion about it. Then the younger brother said, well, it's going to be very dangerous for him to be traveling with public transport to go to work, and work every day. So I'm home because I'm not going to school anymore. So I'm going to drive him and pick him up every single day. For 2 months, he did that. So this is the kind of things that, when I look at it, I'm like, okay, they get it. They understand. Wow. They know how important it is for them to help so that they can protect him, that he's not exposed to any kind of virus. So this is how it is. And is it easy? No. I would love for you to have a talk with the siblings to take their own perspective one day, all around the world, and they can tell you what it is and how they perceive it in their own words, because as parents, we do the best we can, but we don't know how.
Well, yes. No, I agree, because even with my own siblings, it's almost like they always have to live for me. And I sometimes feel sorry for them because, we can never make plans as kids. We can never do anything because they always have in the back of their mind, what if Anne got sick? So yeah, it's really hard for them. And you don't understand when we're in pain, you don't feel yourself in pain because you're just in pain, you're thinking about yourself. But they are in worse pain as well, because they're in that pain of you're in pain, and they're also in pain that they're scared of losing you. It's all that thing that goes through their mind, which is it's until I started talking to my sisters, I started understanding the deep, reality.
Exactly.
Yeah.
Because in a way, you have the trauma of the pain that you go through in your body, but they also have a trauma that they go through, that always watching their siblings, going through that pain, and also looking at the family dynamic, how it is that, everything has to be planned according to the health of one of the siblings, but it is what it is, right?
Yes, it is. And but it makes us closer. It makes the family unit very strong, which is something I admire. And one thing I love about you is that, your son was diagnosed with sickle cell. You still did all the thing you did, but you didn't stop there. You went on to be the president of the Sickle Cell Association of Canada. How do you balance your time to, still manage your son? Not saying, okay, I'm going to stop here, but still going on to be helping others, being a spokesperson for others who are going through similar situation. Well, how do you do it?
Oh my God. Oh, you know what? It did not happen overnight. It's true, but at first, really, it was not planned. I just start taking care of my child, of my son. That was my goal, is to be and to do the best job that I can, for him to have a quality of life. So once I start doing that, and then he started growing up and become older. And at some point, I didn't even know when it happened, when other parents start calling me and asking for advice and looking up to say, oh, your son is older than my son, or I just had a son and I just heard about it, especially in my hometown, where in Niger, where he was among the oldest, so that means she must be doing something good. What it is, let's go and ask her. Parents will call you and ask you. And then I start talking, and then I start sharing, what we've been doing, I remember when we were living in Niger, every Wednesday afternoon the pediatrician will only see sickle cell patients. Well, I can tell you, Anne, for all those, his first 5 years, every Wednesday, unless, he was already hospitalized, we will be sitting on that bench, and that's discipline. And I will go. And to this day, I can give you all the notes, we kept everything, about his treatment, every single blood transfusion, because they will tell you, just buy a notebook, because there were so many things they have to write. So there's a notebook, and the doctor will put every day when we see him, every hospitalization, and we still have it, and he can go through it today and look at it. So I kept it religiously, and I will go, and every single thing I see, I will go and I will ask the doctor, I want to know. And so to me, he said, you can come every Wednesday. So every Wednesday I show up and I ask questions. And so that's how it started for me. And when I moved to Canada, that's when I realized there were patient groups. Okay, so the patient group were there, and I start joining them for Christmas parties, to just I will also take the siblings with me. and like summer camp for him to be able to see other kids who have the same condition as him, and connect with them. And there also parents, even though, realize that, okay, this mom is hands-on and, she's doing that. And I started getting involved with the patient organization in Quebec. And from them, I became the vice president for 3 years. Then when the national organization was created, then I was sent to represent Canada. And I was the vice president for 3 years before I became the president in November 2017. So to this day, I can tell you, I still see myself as a mom. I'm just a caregiver who's trying to do the best she can to support the child. Our priorities have changed, because he's an older person now. He's an adult, a young adult, as I call him, living with sickle cell. So the challenges are different, but there are challenges, keeping a steady job, and sometimes also now there is this dealing with the fact that, you have more challenges than other in the workplace. You have to maybe work more, or you always have to rely on your colleagues. So that can bring some anxiety, so you have to deal with different challenges. So it never ends, So then you continue to be a support for that person and advocate. So here we are, here we are, sharing experience, and then also moving forward. And
it's so amazing how you just transitioned there, but that has helped. But one thing I found when I was in Canada is that there was a good understanding of sickle cell disease, and also something I was very surprised about. But are there challenges living in Canada when it comes to the treatment of sickle cell? Are there still challenges that you find as the president of the organization?
Yeah, so I have to talk about Sickle Cell Disease Association of Canada so that I can answer your question. So the Sickle Cell Disease Association of Canada is a national umbrella for provincial organization. It was founded in 2012, because there was a need to advocate at the federal level for something that, the provincial organization could not do. And there was also a need for us to be under one umbrella to have a strong unified voice to be able to advocate. So I can tell that, that in Canada, we have a good healthcare system that provides care for all Canadians. And with sickle cell disease also, I can say that we have a good team of dedicated, healthcare providers who provide a good supportive care, and in most of the big cities in Canada, you will be able to have access to a hematologist who knows sickle cell and get a good care. And at this point also, we also have a patient group in every province, just I think one left, Saskatchewan, where we don't have representation for now. So, and you can also connect with a network, get support of from peer support and everything. However, there are still challenges. There are challenges in the sense that we do not have access to some of the new therapies and curative therapies, for now in Canada. So that's what we advocate, So you can have good supportive care if you live in Canada and they know the disease, and they know how to manage, that care for you. But then we are working as patient group, we are advocating and we're pushing, and we collaborate with everybody to bring everybody at the table, because you know what? One of the things that I found in the community is that we need to understand that everything that's been done, like by the healthcare provider, by the policymakers, is being done for us. But the solution is going to happen with us. If something is being done for us, it should also be done with us and by us, because we also have a part to play in this. And that's when our role comes in as patient group. We need to educate our community. We need to talk about treatment adherence. It's very important that, you stick to your treatment regimen, that you show up at your doctor's appointment. It's very important that also we participate, in clinical trials, because if they need to develop a new drug, the researchers need to have access to our community. And also we need to engage the healthcare providers community for them to come. To be like attracted to the sickle cell field, to do research and to care for our patients. So all that together are the challenges, and I think our community in Canada is really working, on that very well. But we'll get there.
You said you're from Niger.
Yes.
How are you sharing knowledge with what you're learning on ground in Canada and translating that a little bit to people who are less privileged or less fortunate with information and understanding of sickle cell. How are you utilizing your position to help those people out there in Nigeria?
You know, this is one of the things that really breaks my heart because when you look at the difference, you know, access to care is one of the issues. You know, when you look at what we have available for us here in Canada, it's always, you know, a challenge, and it's heartbreaking to see that, you know, children are still dying under the age of 5 or even 10, you know, in some countries. So I am really connected to the sickle cell community in Niger. They have a group that was recently funded, you know, and actually we have a support group that I am part of, you know, and every information that I think is relevant to their community, I share it. And I'm kind of a mentor. And my son also has a small support group where, you know, he connects directly with them, because now that he's an adult, he can share his experience himself. Yeah. So they talk with him and they ask questions, and I am very careful not to, how do we say, not to sell hope, right? I want to give them information that they can use. For now, what do they have access to? Blood transfusion, hydroxyurea. So every information I share, and I tell them, here are the other, you know, treatment options that are available. But even in Canada, this is what I have, this is what you can have. So, and we are now working with this group to try and see how we can support them even to get a center where, you know, sickle cell patients can go for reference, you know, for information, you know, apart from the hospital, but how can they connect on a platform where they can get more information? So we have now a group where really information is there. They can ask any questions, and I really put a lot of information there just to inform them. So, but I would like to see more there. You know, I would like to see this population have access to blood exchange, you know, treatment, because it will help so many, And it's sad that I am in Canada and only in that group that I will connect someday and see that somebody has passed. You know, the death toll is really still very high in Niger than compared to here. Yeah. So I'm like, we should get them to a stage where they can maintain these people, you know, and have quality of life.
Yeah.
And painless.
Yeah, no, I know. It's so unfortunate because, you know, you think with Africa we'll probably be advanced because the heritage is from us, but I really admire your work. But you also gone on to do the global Sickle Cell Alliance. I read about this, where you are also a member of the Global Sickle Cell Alliance. Why was this organization formed, and what is this own mission in helping solving the problem of sickle cell disease?
So, as you know, sickle cell affects so many people in the world that, you know, there was a need for us to come together globally, you know, as one, because sickle cell affects us, you know, all, even though it affects us in different ways, you know, per se, but, you know, we are a big community. And the first thing I'll say that it was created, you know, to reduce the global incidence, you know, of sickle cell disease. And the second most important thing is also access to care. As simple, that's exactly what I was telling you about Niger. So when you are here in Canada and you have access, you know, to hydroxyurea therapy, that you have access to the blood exchange, or, you know, any other treatment that can help you have a better quality of life, there is no reason that somebody living in Nigeria, in Senegal, or in India shouldn't have access to the same thing. So it's kind of our responsibility as patient group, you know, to create this platform where we can get them, you know, to come to this stage that we are here, you know. So that's the main goal. And a lot of countries have come together to form this global organization, and we're working. I know it's not going to happen overnight, but I'll be so happy to see that somebody in Niger will tell me, oh, I just came back from my blood exchange treatment yesterday and I'm feeling wonderful for the next, till my next treatment, you know? Yeah. That would be a dream come true.
No, honestly, that brings me to my final question about hope. You know, there's so much going on in the world around sickle cell. There's still, you know, you compare it internationally to other diseases, and even though sickle cell is one of the most prevalent disease, genetic blood disorder in the world, you still don't see a lot of investment in sickle cell. It doesn't matter what country you are, the investment in sickle cell is still very low. And there's still stigmatization, as you've seen in Africa. Still, people don't want to talk about it. They're hiding their kids. They go to hospital at night, so nobody sees them going to hospital. My final question, in our conversation, is that what is your hope for sickle cell disorder in terms of how we reduce stigmatization in Africa, or how we get more funding, or is it research? What would be your hope for sickle cell?
Oh my God. Again, I'm going to start saying that this is exactly where, as a patient community, we need to come together, because everything that you've just said that now it's needed in the sickle cell community is not going to be done for us. So my hope, my first hope, is to have a strong, unified voice, is to have us come together, and decide, what are set some priorities in our community and work for it actively ourselves.
Yeah.
When you talk about research, yes, there is funding is really minimal. And again, in countries where the government are doing their work correctly, as you see in Canada, we are getting some supportive care, and we are advocating, for curative therapies and new therapies. And I know that, we will get them at some point, but sooner than later. But here is the thing, when I think about research, interesting that I look and we are waiting for funding. So just imagine that if we have 6,000 people living with sickle cell disease in Canada, and if I'm looking to set up a national registry for sickle cell and I need $15,000 for that, and I've been advocating for the past 2 or 3 years to look for this funding, and I look at the community affected by sickle cell, if every single person stand up and donate $5, we will set up that registry tomorrow. So my hope is that our community gets involved, raise their voices, also, and then put the effort there. Whatever your expertise is, whatever kind of support you can bring, you bring it first. So when we do that, because our lives matters, as a matter of fact, now we see that Black lives matter, sickle cell life matter too, right? So if we bring everything together, we do that, that it's going to put us advocates in a better position to go, and advocate for more, for research, and advocate also for the fact that we shouldn't be treated differently, because this condition, is a genetic condition. So that's what's bringing me to the stigmatization in our community and outside of the community, that I think the only way is to talk about it. What you're doing today, Anne, is it's very important to show them that, what, somebody with sickle cell can be anything they want to be if they have a good support system. They can be who they really are, because they're as intelligent, as talented as anybody else. But yes, sometimes this disease is painful, it's a debilitating disease, so they might need more support than somebody else, but as a community, we are able to provide it. We're able to bring it if we really sit and listen and work together, collaboratively. That's my hope. It's just to see us come as one strong, unified voice, and put the resources that are needed to support this cause. It will be like, I've seen it, for example, I've seen it in the hemophilia. You see how they work in hemophilia. How they work is that they come together, as patient community, and they work closely in collaboration with the healthcare provider. They work with the policy makers to bring change. So I've seen it, when there is collaboration, things can be changed. Success happens. So we need to do the same thing in our community.
I think so. Honestly, I'm so glad you took this time out to speak to me, because, these are such important issues, and you've just nailed the point on the head, on the nail, with the key message you left there, which is about we coming together. And because when you come together, you're stronger, and you speak louder, and you speak in one voice. So rather than you saying something, someone else saying something, it doesn't make sense, and then you confuse the bigger audience who you were really trying to attract to your circle. Exactly. And so that's the thing. We want to always come together with unified voice. But I know what you're doing a great job in Canada, and not just in Canada, you're doing it globally, because I reached out to you because not just the work you're doing in Canada, but also the work you're already starting to raise your awareness in Africa. And I really thank you for everything, Biba. Thank you for joining this conversation. And
Thank you so much.
See you again soon. Thank you.
Thank you, Anne.
You're welcome. Bye.